Hi, my name is Jana Holzauer. I'm a registered nurse and I currently go to Fort Hays State University. Currently in leadership and management. Today, I will be talking to you about psychotropic medication adherence in those with mental illness. So what is mental illness? NAMI defines mental illness as a condition that affects a person's thinking, feeling, or mood. Common mental health disorders include attention deficit hyperactivity disorder, anxiety disorders, bipolar, borderline personality disorder, depression, schizoaffective disorder, schizophrenia disorder, post-traumatic stress disorder or PTSD, and eating disorders. So what are the causes of mental illness? Mental illness isn't caused by just one factor. It can include many overlapping factors, such as genetics. If your parents had a mental illness, you may be predisposed to getting a mental illness. It could be from your environment, such as if you had a traumatic environment as a child, like abuse. It can be your lifestyle, such as alcohol use or if you have a stressful job. And it can also be caused by biochemical processes and basic brain structure that can prelude you to get a mental illness. All of these factors work together and just cause a perfect storm for you to get a mental illness. The culture of mental illness in the community. NAMI reports 1 in 5 U.S. adults experience mental illness in each year. 1 in 25 U.S. adults experience severe mental illness each year. And suicide is the second leading cause of death for people aged 10 through 34. The annual prevalence of mental illness among the U.S. adults by demographic groups. Non-Hispanic Asians have 14.7% mental illness. Non-Hispanic whites, 20.4% mental illness. Non-Hispanic Black or African American, 16.2%. Non-Hispanic mixed multiracial, 26.8%. Hispanic or Latino, 16.9%. Lesbian, gay, or bisexual, 37.4%. Non-adherence to psychotropic medications issue identified. People with severe mental disorders are presumably not adherent to psychotropic medications because of poor reasoning and lack of understanding of their diagnosis and the management of their diagnosis. And here's my source for that. Other reasons for non-adherence participants with severe mental illness gave in one study were the side effects, negative expectations of the medication, improvement of symptoms or feeling that symptoms were not severe enough to take medications. This is kind of like the antibiotic phenomenon of people. Once they start feeling better, they think, oh, I don't have to take the medication anymore. So they stop taking it, even though they really need to continue to keep that up. Preference for a different treatment, not thinking they had a mental illness to begin with, distrusting of all medications, viewing taking medication as a handicap, and getting better advice from friends or family. Not necessarily better, but they see it that way. The social impact of non-adherence. Psychotropic medication non-adherence can lead to worsening of their illness, reduced effectiveness of the treatment, less responsive to subsequent treatment, rehospitalization, poor quality of life, relapse of symptoms, increased comorbid medical conditions, depletion of our healthcare resources, and increase in suicide completion. Here is some insight I got when I precepted. I precepted a nurse manager on an inpatient psychiatric facility that recently opened. The length of stay for patients are supposed to be on average 3 to 5 days, with the greatest stay a month and a half. It was explained how over 1/3 of the admission to the facility since opening have been repeat patients. These patients have already been to this facility, got treatment along with medication adjustments, but returned soon after. This is very frustrating for staff because they put in all the effort to help them and then they just come back. While precepting, I learned over half of the facility's admissions have been due to non-adherence to their psychotropic medications. This insight led me to research the critical issue of psychotropic medication non-adherence among those with severe mental illness. Analyzing the issue. Strengths. A much needed addition of a new state-of-the-art facility dedicated to mental illness. Well-trained psychiatrists, nurses, and therapists. Cutting-edge treatments available. Weaknesses. Repeat patients after previous inpatient treatment. Hospitalization of more than half due to psychotropic medication non-adherence. Psychotropic education inadequacies. Despite our best education on the medications, these patients still come back. Funding. When training the incoming staff, a portion of the funding for new hires should include medication and medication adherence training for the physicians in direct contact with the patient. So here are my recommendations. Education on psychotropic medications for the patient during their whole stay and not just at discharge. A study evaluating the effectiveness of 8 sessions of adherence therapy focusing on medication problem solving, beliefs and attitudes concerning taking medications, and attitudes of taking medications in the future. Results indicate that participants display substantial improvement in positive symptoms, attitudes toward medication, and satisfaction with medications. Another recommendation, education on psychotropic medications for nursing staff employed at psychiatric facilities. Often the medication training is geared towards the physicians and the prescribers, when nurses, we mainly pass medications and we educate our patients. Healthcare staff involved in medication provisions need training to improve their ability to support those taking treatments. The next recommendation is more regulations on prescribing long-acting psychotropic medications. Oral psychotropic medications may not be the best option for patients who forget to take their medications or those who have trouble swallowing. Other patients may prefer to have a depot injection because it avoids the daily routine of taking medications, or they may prefer to have less contact with mental health services. And here is my reference page. I want to thank everyone for listening, and I wish you well in all your future endeavors.